Fertile Minds is a podcast brought to you by Virtus Health, who have more than 40 fertility clinics globally and in Australia, including Melbourne IVF, IVF Australia, Queensland Fertility Group, and Taz IVF. Our goal is to demystify fertility and assist you in getting pregnant faster. Over the coming episodes, we'll be sharing helpful tips and evidence-based advice around key fertility topics. So be sure to browse our episodes and subscribe so you don't miss a thing. You can also watch a video of these recordings on our Fertile Minds YouTube channel. Let's dive into today's episode. Welcome to Fertile Minds. I'm Dr. Shadi Kashaba, a fertility specialist at IVF Australia. I've been trained internationally and worked in Australia, UK, and the US, and did my CREI, which is a Certificate of Reproductive Endocrinology and Infertility, here in Sydney, and complemented it with male fertility training in the US and the University of Illinois in Chicago, and been practicing here in Australia for over 12 years. Today, I'm joined by my colleague, Dr. Marcella Martin.
Hi, I'm Dr. Marcella Martin. I'm a fertility specialist at IVF Australia. I did my training here in Sydney. I did my medical degree at Sydney University, and I have a genetics degree and a master's in reproductive medicine from UNSW. I've been a specialist at IVF Australia for about 15 years, and last year I took up the role of clinical director of IVF Australia South Sydney, and I've recently taken a more senior role at the University of New South Wales in teaching of reproductive medicine.
We are going to kick off today's topic with our Fertile Fast 5. Marcella and I will answer 5 fertility questions so that you, our listeners, can get to know us. Marcella, what sparked your passion for fertility?
Well, for me, it was when I was a junior doctor and I was invited for a cup of coffee with the late Professor Jeff Driscoll. And he had his own laboratory for IVF back out west. And he invited me in and showed me around. And I think I must have been an intern or year one medical sort of graduate. So I was working as a junior doctor. And I met someone who had such passion for what they did, also some compassion as well. And he showed me around his laboratory and I was just hooked. I thought, well, in my past, I've done genetics, I studied genetics as well, and I always knew I wanted to do obstetrics and gynecology. So those things were sort of marrying right in front of my eyes, and I thought, great, that's the pathway I want to do. And IVF, the big clinics, they were in their infancy at the time. So, yeah, very sparked by that encounter. A wonderful man. And Shadi, what was your most memorable fertility moment?
Got lots of those, Marcella. But I think the most memorable bit is probably when I was going through IVF myself, me and my partner, and when we went through the lab. And at the time of the transfer, I saw, which my daughter is now, being an embryo on the screen and almost like 100 cells clumping over there. That's a magical moment. I'll still get on my phone. I look at it every other week.
I remember one of those conferences we went to, and I saw you sitting next to me there with your beautiful daughter in a papoose, and I thought, wow, well, you've come a long way. It was great to see, moving forward.
Tell me, what is the most important advice you have for individuals or couples undergoing fertility treatment?
I always advise people to for couples to not lose sight of each other through this process, and for individuals also to ensure that they've got their support group nice and strong so that they've got people to lean on all the way through it. Of course, that's what we're there for as well. We're not just there for the mechanics of it all. We're also there to give assistance and guidance, and we're lucky we're backed by a team of great nurses, and we've got counsellors as well to keep our patients going through this process with as much support as possible, because that is crucial, I think. But Shadi, what's your favourite part about being a fertility specialist?
That phone call when you say you're pregnant. I think that it's the hallmark of the whole journey. It gets us along and creates teams, ups and downs. But when we reach that destination, of course, that's the first step. But getting a positive pregnancy test makes it all meaningful.
Isn't it also great when you do that ultrasound for the first time on someone and you show them that heartbeat and they hear that heartbeat and they're not expecting it necessarily to hear it? That's always a great moment, don't you think?
It is. It is. Yeah. I don't. A lot of couple when they come in, or patients when they come in, and they're pregnant, it doesn't become real till they see that heartbeat and hear it, and then it hits them. It's like, it happened, and it's such a magical moment to be there with the team from the beginning of that journey to reaching to that point.
And so, Shadi, what excites you the most about the future of fertility?
There's lots of things, Marcella, but I think it's the advancement, as you said about your journey with meeting Jeff Driscoll back in the lab, is completely different times, and it's one of the most exciting thing about fertility is every day is a new science coming up and emerging, and new evidence, new technology, technique, improving our success rates. And in the early days, it used to be 5%, and we're approaching 60 to 70%. Per embryo transfer, which is like staggering response. And to get to the 100% hopefully in one day and help everyone to achieve their dream becoming a parent, that will be hopefully in our lifetime.
We're certainly working on it, aren't we? We're introducing new AI technology. I'm pretty excited about that and how it's helping us pick better embryos. And, while this technology is really expensive at the moment, it's going to be on mass production down the track. We can all see it, and the costs are going to come down, just like with genetic testing. Remember the days when just to do one gene test was so expensive, and now because we do it en masse, we're bringing costs down, and we're even bulk billing some tests, like since the 1st November last year, there are certain gene tests everyone's entitled to now. A lot of people just still don't know about that. So I think for me, the world of genetics and the world of AI are very exciting in the field of fertility.
Absolutely. I think AI will change a lot of things in our lab. But hopefully, I think the hallmark is when we can be able to do IVG, which is like when you can make sperm and egg in the lab. For couples who don't have any eggs or don't have any sperm, that you can actually grow some sperm or egg from certain tissue in the body. We'll get to the next section, which is called In the News. Each episode will break down the headlines and discuss the latest news in fertility. There has been a lot of coverage about donor registry laws in the news recently. So first of all, what is a donor registry and how is it regulated? The regulation of egg, sperm, and embryo donations in Australia varies from state to state. Victoria, New South Wales, South Australia, and Western Australia have a centralized donor register, which gives donor-conceived people access to information about their donors when they turn 18. This allows donor-conceived people to learn about their genetic identity and medical history to better understand their origins and manage their health. Queensland and Tasmania currently don't have any laws governing donor conception. In recent months, new laws in the fertility sector has sparked calls for a national donor registry in Queensland. What are your thoughts, Marcella?
So this was a big topic, wasn't it, Shadi, at the recent Fertility Society meeting in Perth. It's about time that we get all the states doing this, having a registration board, so that we can empower these kids that come up from these pregnancies to have ownership of some of the genetic information and health information that we have from the donors, so that these future young adults, when they turn 18, they can go to this registry and look up this information, which, as we know, medicine's becoming more genetic based. It's precision medicine for the future, where individual treatments will rely on your own DNA information. And so that information is going to be crucial. My understanding is that this has been going, we've been in New South Wales, we've been doing this since 2010 when the Act came through. So we've got Western Australia, as you said, South Australia, Victoria, New South Wales all doing it. I don't know where Queensland was at. They're way behind the ball, but they're moving forward with this now, which is really exciting and great for anybody that's undergoing fertility treatment using donated gametes in that part of the world. Obviously, Tasmania, I'm sure, will follow suit as well. So it's great news. Wouldn't it be great if we had one registration for the whole country? That's the obvious next step, but we've got individual registrations in each state. So unification of that would be the next step.
Totally agree. I mean, we see the positive impact of those registries in certain states that had them, like we had them here in New South Wales and Canberra, where they had it for a long time. And the accessibility between the donor-conceived children or even the parents, sometimes when they want to access certain information earlier on, that helps them to navigate certain health challenges that happen later in life. And even with children, sometimes they want to have a story they want to meet. Everyone needs a story for their life, and going through that to know what's the motivation, what's the story behind them, and their ethnic origins help them to define themselves. So definitely, I think it's a way going forward, and it's a positive thing to consider. So fingers and toes crossed it happens soon.
And what should be mentioned is anybody that was conceived using donor gametes before 2010, you can still utilise that registration board and actually voluntarily give your information as someone who was conceived to that board, and then they use that sort of trying to help you sort of see if there is any other information out there, if there are any half siblings out there. 2010 doesn't sound like that long ago, but when you think about it, that was the time when IVF big clinics were really just taking off. So, we have been keeping up with as much as possible with the changes, I think, as the clinics have grown bigger and more people have been able to access fertility treatments. This is a well thought out plan to set this board up. Doctors can come and go, clinics they rise and fall, but at least that information is kept in one place for the future of these kids. Yeah.
Absolutely agree. And I think Australia is leaps and bounds ahead of other countries in that realm by creating registry. And I think a lot of countries will follow suit. Let's delve into today's topic, fertility care for LGBTQIA plus community. We know there are a range of fertility treatments available for same-sex couples and gender-diverse people who want to start a family. Now, what are options for same-sex female couples or male couples or surrogacy and gender-diverse people? We'll discuss that with Marcella in a tick, but I would like to highlight the new definition of infertility that has been proposed by the Society for Reproductive Endocrinology and then got endorsed by the college in Australia and then submitted to the government and became the official definition of infertility to be inclusive for all people who want to reproduce. In the past, it used to be infertility when heterosexual couple have sex for a year, they can't conceive, and that defined as infertility. And it doesn't suit the times or the population that are trying to fall pregnant or start a family here in Australia. So the new definition is infertility is a disease characterized by any of the following. Number one, inability to achieve a successful pregnancy based on parents' medical, sexual, reproductive history, age, physical findings, diagnostic testing, or any combination of those factors. They need medical intervention, including but not limited to the user of donor gametes. Gametes means sperm or egg, or donor embryos in order to achieve a successful pregnancy, either as an individual or with a partner. In patients having regular unprotected intercourse and without any known factors for either partners suggestive of impaired reproductive ability, evaluation should be initiated at 12 months when the female is under 35, and at 6 months when the female partner is 35 years of age or older. Nothing in the definition should be used to deny or delay treatment to any individual, regardless of relationship, status, or sexual orientation. What are your thoughts about this new definition, Marcella?
Well, it's about time we change those definitions, and hopefully those new definitions will mean that we can then drive forward the equality of Medicare rebates for fertility treatments. So, a very important new definition to have in our field.
Absolutely agree. It's a work in progress. All right, we'll start with same-sex female couples. What are their fertility options, Marcella?
Well, through access to donor sperm, an increasing number of lesbian couples are achieving their dream of having a baby. For couples who want a child that is biologically related to one of them, there are 2 treatment options available. First option would be an intrauterine insemination program, which involves putting the donor sperm directly into the uterus. And the second option is IVF, of course, which involves a combination of sperm and eggs in the laboratory to form embryos. The highest quality embryos are then transferred into the uterus, where they will hopefully implant and develop. You may wish to use sperm donated by someone you know or clinic recruited donor sperm, which you can access through our donor program. And of course, there are ways that both partners can be involved in conception. We have reciprocal IVF, which is otherwise known as egg sharing, which is an option available for lesbian couples, allowing both partners to be intimately and biologically involved in the conception process. And in the reciprocal IVF process, one partner's eggs are fertilized using donor sperm, and the resulting embryo is then transferred into the other partner, into their uterus. And therefore, they're both intimately linked to the child that ensues. And there might be various reasons you might do it both ways, like sort of egg sharing both ways, or it might just go one way for various reasons. To make reciprocal IVF possible, of course, a sperm donor is needed, and that's where we can help through our sperm donor program.
Yeah, and that's one of the advantages of IVF. I mean, there are differences between the insemination and when they do IVF. So insemination it's more natural, but it's lower success rates. They can't bank embryos for their future use, and they can't do the egg sharing process. So it's a lot of discussions that goes between us and the couple, and to decide what is best for them to how to start their family and complete it for the same process.
So Shadi, would you like to go through some of the options for same-sex male couples?
So same-sex male couples, I mean, usually they will have sperm. I mean, if they don't have sperm, both of them, they might need a sperm donor. But if they got sperm, depends if they got an egg donor that they know, or they can access our clinic program, which we got egg donors that they want to give their eggs to other couple or persons that they want to fall pregnant with. Basically, the process is straightforward. We say it's 2 by 2, creating embryos. So the parents or intended parents, either a single or same-sex male couple, they will need to see a medical specialist, and then the donor will need to see the medical specialist. And then we start the process of IVF for that process. They'll need to collect the eggs and create embryos. Now, there are 2 processes too. They'll need a surrogate or uterus to grow those embryos. And what are the options for gender diverse people? What are your thoughts about that, Marcella?
Well, many transgender, transsexual, and gender non-conforming people want to start their own family. If you are transgender, If you are transgender and preparing to undergo medical gender affirming care, one of the many important decisions you face prior to whether you would like, before you start your treatment, is whether you would like to have a family now or in the future. If you choose to preserve your fertility and store eggs or sperm prior to transitioning, you have the option to have them thawed and use a partner's or donor's sperm or egg in an IUI, IVF or ICSI procedure in the future. We can get very creative. Depending on your circumstances, a surrogate may be required to carry the pregnancy. So I do think the point is to make sure that people that are going through various treatment pathways, that they should be counselled, and you don't know what you might decide along the way, or if you have a partner in the future, what they might need from you. So, those things we can cater for.
Yeah, I totally agree. I mean, well-informed and counselling opens options later on, and they can make an informed decision what they want to do. But I mean, always banking some gametes I think is a good idea, because people change their minds until it's later in life.
So, Shadi, would you like to discuss some of what surrogacy involves?
Yeah, surrogacy is becoming more and more common here in Australia. We know that surrogacy in Australia has to be altruistic. So the surrogate can be paid for the surrogacy service. She can be compensated for any time lost from work, any expenses she incur, and medical, of course, appointments and coverage that's related to the pregnancy. But it can be paid for the pregnancy itself. Now, surrogacy has two main forms, either traditional surrogacy or gestational carrier. Now, anyone could need a surrogate. That just means someone to carry the pregnancy. Could be a single person, could be a couple, could be a heterosexual couple, could be a same-sex couple. So anyone could need a surrogate. It's just they need a uterus to carry that pregnancy for 9 months. Gestational carrier is someone who carries a baby that is not genetically related to them. So it's created embryo through other gametes provider, either intended parents or a donor, and then she carries the pregnancy and delivers it and then hands it over to the intended parents. Traditional surrogacy is when someone provides the egg and carries the pregnancy at the same time. So she's genetically related to the child that was born. And once the child is born, the traditional surrogacy, she hands over the child to the intended parents for that. And the process changes between states. So each state has its own legislation and own process for applying for a parentage order later on. But that's the two main types of surrogacy available. So, Marcella, where can people find support when they go through their fertility journey?
Well, starting a family can be very, very challenging and an emotional experience. For the LGBTQIA plus people undergoing fertility treatment, counselling and support services are available to help navigate the whole journey. In fact, as soon as we are putting you on a wait list for any donated gametes, sperm, eggs, etc. as well, it's mandatory for us to put you through 2 counselling sessions, and everyone I've ever spoken to finds them beneficial. They don't sort of say, oh, I wish I hadn't have done that. So everyone has that option. It's good to remember you're not alone. We encourage you to connect with other couples or individuals undergoing treatment to share your experience and seek comfort and support. And so we've got ways of making that happen. I really enjoyed that discussion. Let's move on to our next segment called Mythbusters. So, with so much information about fertility, it can be difficult to separate fact from fiction. That's why we're here to bust the biggest myths and give you the facts about fertility. We know that age is the number one factor affecting fertility in women or people with ovaries, but it's often assumed that males or people born with male anatomy don't have a biological clock. While the effect of age on a male's fertility is not as significant as it is with women, there is a decline in the quality of sperm after the age of 45. After this age, it can take longer for men to conceive, and the chance of having a baby with health problems slightly increases. Shadi, what are your thoughts?
I totally agree. I mean, definitely there is a biological clock for men. We know for a fact that when men are older, the chances of them conceiving are lower. And we know that rates of miscarriage goes up. And we know that certain health conditions and medical conditions increases the risks with older fathers. Now the jury's out. Do men should they freeze their sperm as women freeze their eggs? So still the jury's still out there if they should freeze their sperm. But definitely if someone not considering to have children in their 30s or 40s, they might consider freezing sperm, because it will be more pronounced in the future, and we'll find more and more things that affect the sperm ability to achieve a pregnancy. I mean, there is quite interesting. There is some tests that you can run on the sperm, and it'll tell you what's the age of the sperm provider. So you can know the person's age from his sperm through a sperm test.
That's quite interesting. And we know those health issues with children born from older sperm do exist, and there's some genetic conditions, and there's also some learning difficulties. So choose your sperm wisely, I guess, is the motto.
Thank you so much for listening today. We hope you'd found our episode helpful as you embark on your fertility journey. Marcella, thank you for joining me today. Where can people find you if they want to connect?
Well, you could find me through my website on drmarcellamartin.com.au or through the IVF Australia website.
You can follow me on Instagram at dr_shadi_kashaba or visit my website at fertilitysydney.com.au. To learn more about myself or Marcella, look for us in the specialist section of IVF Australia's website at ivf.com.au.